we're now going to go into the updates from Bernd, who is in Germany. I don't know if Bernd's going to do that in German and then English, but over to him, and I'm sure he can introduce himself. Thanks, Bernd.
Thanks a lot, and thanks a lot for having us. I hope you can see my screen first of all. That would be brilliant if that works. Can you see the
Hey,
presentation?
it's just coming through. There we go. Perfect.
Oh, okay, great. And then I would start with a question. If it's needed to translate it into German, maybe just give me some signals, hands up. Wenn ich in Deutsch auch präsentieren soll, bitte ganz kurzes Signal. Wenn alle im Call Englisch verstehen, dann würde ich die Präsentation nur in Englisch machen. Okay. So I didn't get any signals that German was needed. So if it's okay, I would stick to English then. And what we do anyhow is to whenever we have the information about the conference today, we also translate it into German so that really all interested people in our community can understand it. And as there was no signal to switch from English to German, I'll stick to the English so everybody can understand. Uh, after today's presentation, I have to say it feels a little bit like moving into Stone Age, but into a very early stage of working with Alström, because for whatever reason, we in Germany, we haven't been that far, to be honest. And it makes us very proud, at least now, that we can say now we have a really strong and big community, and we finally started really to supporting this fantastic international community in working with the Alström gene. So on the one side, it's not understandable why we are not as far as many of you are already. On the other side, we are finally there to really start working. So it's a great pleasure for me to share what we as Alström Germany did this over the last couple of months, and what are our plans for the future. I hope I can move my. Oh yeah, that's a first snapshot of our German community. We had our first meeting in September last year. We had 40 people that joined this meeting simply due to the fact that we didn't have more than 40 spaces. But it was really fantastic to welcome all the people to our first meeting, and very special people, all motivated, all enthusiastic, very positive, and it gave us a great feeling to know that we now have a community set up that's really supporting each other and working for the good, and trying to get things forward. And I hope this picture, for those who can see it, gets a little bit of this positive spirit across. If I'm saying last year, yeah, it's a very young organization. So basically, we started, I would say, in a structured way, working with Alström about 2021. I call it fixing the basis. So it was really getting Alström a little bit on the agenda, creating first networks, and finding first clinicians to work with us. And after we managed to do that last year, we finally found the patient organization to really now go the next big steps together. And we grew up to 100 members already, which I think is quite significant. We have 15 directly affected people from Alström in our group, and a big crowd between 100 and 15 are really supporters, parents, caregivers that are also joining us, or that joined our organization and are supporting it, being it by the fees they're paying or by active work they're bringing into the group. And we have an age range which is quite broad, I think, up to 40 years. And we're also taking care of or we're having members also in Austria, and that's one of our kind of offerings that we are doing. that we want to be there in the first for all those who are speaking German, being it in Austria, being it in Germany, of course, in Switzerland, people from the Netherlands that speak German, or in other regions of the world, whoever speaks German and would feel comfortable in a kind of organization that speaks this language, are all welcomed to really join us and support us. So that's for the for the time being, and I think quite impressive after a little bit more than half a year of existence. We grew already quite significantly, and of course we are open for each and everybody who wants to support us on our way. That's what we did in the last months. I think also something to be proud of. A lot had to do with really getting on the map. You know that also in Germany and the German health system starts caring a little bit about not a little bit, but really care about rare diseases and especially the Alström syndrome. There is now kind of a low dynamic, I would say, starting especially talking about rare disease, but also for the Alström. We one of the big foundation in Germany support us, which is fantastic. We get support the government. We are getting into kind of significant processes. It's still all very thick, but nevertheless, we are getting somewhere. And we are doing a lot as a community, being it fundraising or trying that everybody really in a way tries to communicate about what we're doing and get support. So I think we are well on. We really moved it for such a short period of time. But I don't need to tell you, it's just the beginning of a very long journey we're going to. Our targets is really, and that's not on the slide. The left side shows more or less the official part. I'm not going to read through it. On the right side, it's like what we want to achieve on the short term. And one very positive we didn't mention here is we want to be positive. So we want to encourage people, and we even want to give back to society in a way that's maybe different to many other. That's there, know that we are suffering. No, we want to encourage by showing we are working with special peoples, and that's one thing that's very important for me. I don't like to talk about patients. I don't like to be some other people. No, we are all people. We have all our feelings, all our emotions. It was a rare disease, being it with something else, it doesn't matter. And all these people have so many skills, have so many things to give, so many positive, encouraging things to show to give. That's very important for us to really also get that across and say, guys, we are talking about people that we are all people and we all need support and we all want support. And on that basis, we want to work and work together. So some other things like already be or people that speak our language or beyond if they feel comfortable with working with others. It's extremely important, and this is why I'm so happy to be here now and also to see Anne. She was really one of the first supporter of actually my way when I started 3 years ago. And it was valuable as not many other things because she supported what we were doing. It was there with Wise. From UK in total was there with Wise. They invited us to see what they are doing, and it showed how important it is to work together. Because at the end of the day, we are such a small community. If we are not bundling our forces on a global level, then I really think we didn't understand what we are dealing with and we didn't take our chances. And so it was extremely important to be so welcome in this community. Sorry, there's an alarm clock going on my side. In case I'm quickly running, there is a fire. Otherwise, it's just a emergency test. I hope it's not too disturbing for the time being. But like I was just talking about our global cooperation also with Chase and Alström Syndrome International, we are in great contact, and that's what I strongly believe in. We're not gonna get a step forward if we are not working together and really using all our global. We're also working on patient registry. I'll come to that later on. We are creating forums for us internally so that we also have a good sharing platform for patients and caregivers and this environment. And of course, we need to find places to get together. And last but not least, very important, fundraising. I think everybody knows important that is will all be one of our short-term goals. And one thing, and I'm not going to confuse with this picture. I'm sorry. That we also want to have like a center of excellence. Like we could learn from UK, from Birmingham, to really create places, being it physical or virtual, it doesn't matter, where everybody who needs support gets support. And I think there's so much to learn from this community, and we want to take the learnings as well and bring it into our German community. What we currently basically doing or what we are involved with, I think it's a lot of groundwork actually still. So setting up structures, of course, we need stable financing for our community. We're trying to get into the international or European networks. So Pietro was so kind to invite us into the ERN network, which is fantastic for us. Of course, we are trying to get more and more established in the German network, medical network, which I think works quite well. We got now the opportunity to get a register for Germany, which is a kind of two-sided coin, if I'm honest, because we know we have our registry in the US that we can use. But what you can feel is that a registry helps as a language to talk to each other within a country, as simple as that. And by being involved in this process in Germany, we are kind of on the map, and all the clinics that are working with it, and it's quite a huge project, are now getting also involved with Alström. So that's for us a big benefit, and that's why we are kind of using both ways. Our common registry that we have in the US together with ACE UK, and the German one that's being built up. ERN network, I mentioned it already. It was very interesting to hear the first conversations today on nutrition and hyperphagia. I hope I said it right. That's something where I'm actually currently fighting with a lot of clinicians in Germany, because we've put everything on the table that we can use, but so far, I'm really struggling to get the buy-in of clinicians. So that's a tough one, even though there would be a solution on hand, but that's something we're working on as well. And of course, important to keep up communication, build up communication, and also get a public profile. I mean, if you put it in the story for that business context, there is a lot of competition. There's a lot of diseases. There's a lot of people needing help. So of course, we need to make sure that we're not getting lost in this big kind of uh, field of needs, if you want. So that's the issue I was already talking about. That's especially important for me, seeing what those wonderful people in our community as well, with their skills, with their abilities. I also want to fight against disparity, because at the end of the day, everybody who has a additional challenge in his life, he's wearing so much kind of weight over life. You're getting a heart diagnosis. It's hard to find support. It's hard to get care. It's hard to get respected in society. So at the end of the day, so many people are kind of, their way is made more and more difficult. And I don't think that's acceptable in the times that we are living. We need to make sure that all the people who need support in whatever way, they get the support to have at least an equal basis, to live their life from. And I think that's a huge one, but nevertheless, I think it's also up to us to get these messages always and always again and again across, and really fight for that. So that will be a big kind of topic for us as well here in the German community. And we are already planning our next meeting. It will be in September in Germany, and also here, my first invitation, it goes out to really everybody in our global community. Whoever would love to see how the Germans are working, communicating together, really feel invited to join us. It would be great. In what way? Being it virtual, being it really on site. It's the first teaser so that you've heard the dates and the location, and I'm sure we're going to communicate a lot about it. And we would love to welcome each and everybody there to have first of all a nice time together, and then share all our experiences, because whenever we have such an opportunity, I think it's something we need to use to get closer together and be ready for the big challenges that we have. And that's it. That was the quick look into our German activities. As I said, a little bit Stone Age in terms of where we start, but we hope to be more and more progressive and supportive to the global community, and continue especially working with all of you, because time has never been better to find solutions. That's for sure. And I think we have all the things in hand that we need to get some steps forward. So contact us. These are our kind of official website. We already have one. We are on Instagram, and it's getting more and more. And yeah, let me at the end just thank ASUK and Anne especially again for not only inviting us, but making these kind of meetings and these kind of discussions possible. Tremendous what your achievement, what it did. Thanks a lot.
Brilliant. Thank you, Bernd. Fantastic achievements, and the way I'm always impressed with the mums and dads who are just driving forward some of these agendas, real kind of warrior mums and dads and other carers. And what you've done in such a short time is extraordinary. And we now have other conferences, you know, with folk with Alström that many people can go to. So that's brilliant. Thank you. And I think some of the key messages coming through from, you know, everybody who's working and volunteering and trying to kind of drive forward this agenda is that we need to be collaborating, and we need to, you know, you're having forums and things, and that we need to be working together, and we remain, and in many ways just keep improving on that ambition. So brilliant. Thank you, Bernd, as always.